Hello, I'm Charlie Wells and welcome to Self Matters, the podcast where we interview the people shaping the future of mental health. This week, I am thrilled to have as a guest Dr. Philippa East, who is a clinical psychologist, but probably more famous for being an award-winning author for psychological thrillers. An interesting mix of how you write fabulous stories and treat people at the same time. Not only is she a psychologist and an amazing author, but she also coaches other authors about how to handle mental health in their writing, having a huge impact on stigma across the system. So I'm thrilled to have you today. Thank you for joining us.
Hi, yeah, no problem. It's an absolute pleasure to be with you today.
We always like to start our podcast at the beginning, really. Everyone loves to understand who is our guest and how did they become a psychologist, and then how did their career pivot to more sort of systems thinking. So how did Dr. Philippa become Dr. Philippa?
Yeah, so I think my original route into clinical psychology was really standard, but what's quite funny for me is looking back, it also really makes sense as to why I ultimately shifted into becoming an author as well. When I was applying for university, I decided I was going to go to university and I was deciding on what I wanted to study at university. And initially I was looking at things like ancient history, archaeology, philosophy. And then I thought, but I'm going to need to get a job after, so maybe I should apply for something that has a bit of real world application. So I stuck psychology in there as well. And what I ended up studying was psychology and philosophy, which was a lovely combination for me. It was great. I really enjoyed my undergraduate study. And then again, towards the end of my second year, I was like, okay, well, I'm actually going to have to get a job when I leave university. What am I going to do? And this would have been around 2002, 2003, so the early 2000s, when the entire profession of clinical psychology was pretty niche. Like now it is super mainstream, I think. Loads and loads of people want to become clinical psychologists. But back then, it seemed to be really niche. Nobody at university was talking to me about it. So I literally went on Google and I put in jobs psychology. And some information about clinical psychology popped up and I had a read through and I thought, actually, that sounds like a really good fit for me. The way I understood it at the time, which I think was a fairly accurate understanding, was it was this really nice mix of the clinical and the academic. And I've always been a very academic person. I liked the sound of study, research, the real very strong academic basis and theoretical basis of clinical psychology, but also at the same time you would be a practicing clinician working typically in the NHS, boots on the ground, working with clients, working with patients and actually making a difference to people's lives. So I thought, right, that's what I'll do. I went through the application process, which was even at the time was fairly competitive, but not as competitive as it is now. Again, I was fairly fortunate. I did a year as an assistant psychologist, actually in an eating disorder service down in Southampton. And then I got a place on the clinical psychology course at the Institute of Psychiatry. I do appreciate that that's unusual and a lot of people coming into clinical psychology. It's a much longer route. People often do masters. They spend many, many years in different kinds of clinical positions before they get on the course. From there on, it was pretty standard. As I say, I did my 3 years doctoral training. I qualified in 2007, 2008, and then I went on to work in the NHS. I started off in a community mental health team, which was really good, actually. That gave me a really good kind of all-round view of lots and lots of different kinds of mental health conditions, and also working in a multidisciplinary team. So I got to have useful insight into how psychiatry fits in, how mental health nursing fits in, occupational therapy, social work, all of that kind of thing. And then I took some further more specialist jobs in London and in Lincolnshire in a specialist CBT for psychosis team at one point, which was really interesting and a really engaging way of working with people with psychotic experiences, because that's probably one of the mental health conditions that people have a lot of misunderstanding and fear about, and often traditionally it was treated through sort of medication and often hospitalization. I also then specialised again in eating disorders, which has been a bit of a speciality for me all the way through. And my most recent job in the NHS was in a specialist service for complex cases, which in practice meant a lot of complex trauma work. So people who'd had extended histories of childhood trauma or domestic abuse or more complex presentations generally. And we were sort of a step up from an IAPT service, which would have worked with the more mild and moderate cases. And again, we were using some different sorts of therapy models there, We didn't really do so much CBT because that was often covered in IAPT, but we did EMDR and we did cognitive analytic therapy. In 2015, I made the decision to set up in private practice, which is what I've done ever since. That's my backstory of becoming the psychologist I am today.
That's the dream journey for most psychologists, right? Amazing undergraduate degree, get quickly onto a PhD course at a really well-known institution, get to work with really interesting cases, different interesting cases. You've had exposure to lots of different types of problems and people. But I have to go all the way back to the beginning because I do find it very interesting that a young Philippa growing up in Scotland is trying to decide whether she wants to dig things out of the ground and be an archaeologist, or be a great philosopher thinking great thoughts, or understanding the human mind through psychology. And you ended up going for human mind psychology, but you think that the reason was because you needed a job. There must have been something in the early days that grabbed you. So I'd love to hear about more.
That's absolutely right. That's kind of what I was touching on when I said, looking back, there's a kind of undercurrent of this pull all the way through. If you think about archaeology, you discover things about people and how they lived and who they were. I think what I found fascinating about ancient history, again, it was about understanding people and society and how it worked in that time. And I think for me, it was the fascination of thinking about how similar they are to us. And maybe that's that whole idea that there's these human universals that is through time and cultures and all of this kind of stuff. And philosophy, again, is trying to understand the world, but it's trying to understand our understanding of the world, which is kind of psychology again in some shape or form. I think they're all sort of part of the same thing. And the other part of kind of the hindsight thing I was talking about was discovering that writing had always been a sort of sub-theme in my clinical psychology work. For example, my doctoral thesis for my clinical psychology degree was on the use of therapeutic writing in the treatment of eating disorders. It was specifically about the Pennebaker model of therapeutic writing, but I was interested in that clearly. And then when I worked in the specialist eating disorder service and also in the complex case service that I mentioned, as part of the cognitive analytic model, you write these therapy letters, you write a reformulation letter, and you write a goodbye letter. And again, these are all about being able to capture in the words on the page complex ideas and using that to communicate. Obviously, words and communication is such a big part of psychology and therapy anyway, but there was something about, this idea of putting a piece of writing together. Although at that time I was coming at it from the clinical side, it's like the writing was trying to get out.
Well, let's move into the writing bug, because there you are. You've got your own private practice, which is growing well. You've got great experiences over 15 years, I think, as a psychologist before you got found as an author. So why and when did you start writing books? Did you always know that there was a book in you? Do you believe that everyone has a book in them? Or is this something that since you were a kid, you've been writing stuff and reading stuff?
In hindsight, I can see that there was kind of tendrils there all the way along. It wasn't on my radar. I think what's sort of interesting for me is that the background that I came from, although creativity and the arts and this kind of stuff was very much valued and encouraged, nobody in my family, including my extended family, worked professionally as an artist of some kind. For example, my dad was an accountant, my mum was a nurse, my aunt and uncle was a psychologist and a lawyer. My framework was that you get a profession, you get a job, you have a sort of recognizable career, whether it's teaching or nursing or this kind of stuff. There was no template or role model for me to say, actually, you could pursue this as a professional career. So for me, I loved reading. I was a real oddity growing up that we didn't have a television in the house. So my sister and I, we just went to the library and we got books out and we read. So I was and I still am a voracious reader. And then at school, I liked writing short stories. But then I was like, right, university, what am I going to study? Right, something to get a job. And then afterwards it was like, right, get a job, get a career. So it wasn't until I was about 30, I think. And what happened was basically I had finished up one NHS job. I think it was my CMHT job. And I had about a week off before I was going to start my next job, which was this job in the eating disorder service. So for the first time in years, I'd completely closed down one caseload. And obviously I hadn't picked up a new caseload yet. So it was different from when I'd had say, annual leave before, where yes, you're taking a break, but you've still got clients stuck in your head. So it literally felt like this whole other sort of cave in my brain sort of opened up. And this little first line of a novel came into my head, and I thought, well, I'm just going to write it. Why not? I'd mucked around with other kind of creative hobbies before, like I'd done a course on photography, or I'd gone to some pottery classes, or I played the violin. So I'd always been dabbling in different creative pastimes and hobbies. So at the time, it felt like this is just another creative hobby that I'm going to have a go with. So I started writing this novel, which is too embarrassing to talk about because it's just not the kind of thing I want to publish. But I just loved it. And it was like it came together, and I felt like this is the medium for me to be creative in. This fits, this makes sense. And again, I think with my background in reading and books and always having that hankering for the use of words, it really gelled for me.
The first one was not the knock it out the park. So often I speak to authors and everyone assumes that someone sits down one day and goes, oh, I'm going to write this book, and then you're discovered and you're the next Harry Potter. But so often you write short stories and articles, and then eventually the big story finds you. Did you always assume you were going to write psychological thrillers? Did the psychologist and the genre come together quickly, or did that come over time?
Yeah, definitely over time. So this first book that I started writing, I had to abandon it at some point. But it was basically this weird rom-com set in London featuring a protagonist guy who gets into all sorts of muddles. When I realised that I didn't really know how to make this book do anything, and I didn't really understand my craft, I went off to try and learn more about how to write. And then I wrote short stories for about a decade. As I started to get some of those published, I would send them out to literary magazines, literary journals, short story competitions, that kind of thing, and started to get a few hits. I thought, do you know what? Maybe I am able to write at a level that is publishable because I'm getting short stories published. At the point where I left the NHS and went into private practice, I went from full-time to part-time. And at that point, I had this idea for a novel brewing, the novel that ultimately became my debut, Little White Lies. And with more time on my hands, I thought, well, now's the time to sit down and get on with this novel. I've got time to do a novel rather than short stories. And coming into the psychological thriller genre was inspired by the book Gone Girl by Gillian Flynn, that I consider an absolute masterwork of the modern psychological thriller genre. I read that book, and it was the first time I felt I'd come across a contemporary fiction book that included beautiful prose and really sophisticated themes, which you typically find in sort of literary fiction, but it was also a real page turner. Because before that, for me, it felt like if you wanted a sort of more commercial book, more of a page turner, you had romance and you maybe had sci-fi and you had crime and you had sort of action, and none of them were really my cup of tea.
All of your books have some strong themes of sort of secrets and lies and quite traumatic experiences happening to people. You get to kind of play with sort of characters and psychologies and secrets and nervousness and a lot of honesty, I guess, is an interesting theme. Did you bring your kind of skills as a psychologist to creating these characters?
Yeah, definitely. I think about that in two ways for my writing. One is that sort of basic understanding of how, for example, someone's thoughts influence their feelings and their actions, and that there's a logical consistency to that. And also, I sometimes do workshops, creative writing workshops about character, and I introduce the authors to the longitudinal CBT model for them to use. I think it's a very accessible framework for people to understand, and going through with people, what's your character's backstory, i.e. their early experiences, what core beliefs does that set up for them? And in fiction writing terms, this is often referred to as the lie or the flaw that the character has embodied within themselves, their wonky core belief or schema, right? So it maps very much on fictional templates for characters. And then showing them how that will affect, again, using this longitudinal CBT model, we bring that forward, don't we, to these in-the-moment situations where someone will have negative automatic thoughts connected to their core beliefs, and that will then shape their behaviours and their feelings. And I explain to my writers, when we meet your character on the page, scene by scene, this is the bit that we're seeing. But you can give your characters real coherence and consistency and plausibility by pinning that on that kind of deeper structure going back to their early experiences and stuff. I think in general, as clinical psychologists, we learn these models of human psychology, and then we can use those models to design our characters, and so that our characters come across as very real and plausible on the page. And then the other part, I think, is maybe slightly more specifically, you're absolutely right. A lot of the time I'm writing about trauma or guilt or anxiety, denial, these kind of things, which are really classic psychological thriller tropes, right? And again, having that clinical understanding of, for example, how does grief present, or how does guilt affect someone's operating, or how do people cope with and deal with trauma? And again, using that clinical knowledge, even if I'm not necessarily giving my character a overt mental health problem, but looking at some of these universal human experiences like grief, like guilt, like difficult interpersonal dynamics, and using that kind of psychological understanding to, again, hopefully portray that on the page in a way that is coherent and plausible and relatable for my readers as well.
I love the fact you've got models and structures and science all underpinned behind that to try and make it feel real. And it really does feel real when you read your books. And it doesn't feel like it's written by a psychologist, which I think is also important, right? Like, they're psychological thrillers. They're very accessible in real human language, but you can feel those emotions. You were already a really great sort of individual psychologist, and then you started writing books and you started becoming famous and you started winning awards and selling stuff all over the world. I don't know how many languages. It must have been very thrilling. I'm sure there's films and TV shows and all sorts of things in the works. But that must have been a big choice moment for you. How did that moment happen? And then did that lead to you starting to do more coaching with other writers?
I started off as a full-time clinical psychologist who was dabbling in writing as a hobby, weekends and evenings, that kind of thing. And then over time, I was shifting my professional identity more and more towards my identity as a writer and an author, and shrinking down the amount of time or the amount of focus and priority I was giving to my professional identity as a clinical psychologist. The step was going from full-time work to part-time work. And then as I was working in private practice, because I was my own boss, which was very easy to do, I was again shrinking down my hours that I was practicing as a clinical psychologist and giving more and more time to writing, investing more and more in my career development as a writer. And there was a moment where I felt a bit of an ethical, moral conflict about that, because it's such a worthy profession being a clinical psychologist. We literally get to be so hands-on in helping people who have real difficulties. It's such a valuable thing to be able to offer in the world, I think. And the level of training that we go through, we train for a long time and we work really hard to be able to deliver that to people. And I felt like I was saying to myself, I'm not going to use that expertise as much anymore to help people in that way. But I remember having a conversation with my writing friend at one point and talking about this, and she said, but Philippa, you're always going to be a therapist. It's just that you're going to be offering that therapeutic help in a different way, and it'll be through your books. You know, the stories that you tell, the characters that you offer to readers to relate to. And she made the point, like, think how many more people you can offer that to as a best-selling author with HarperCollins than you can seeing individual people in your clinic. And that was really kind of liberating for me to feel like, actually, I can still have this role. I can still use my expertise and maybe reach out and offer something to people, and actually offer something to thousands of people rather than dozens of people. And then I think that because for a while it still did feel a bit like I was wearing two different hats. And so when I thought about offering this consultation service for authors and writers writing about mental health, to offer them a consultation to give them guidance.
That's great. I love the idea of joining the two Philippas, the Dr. Philippa and the non-Dr. and linking them with the consultancy service. I guess if you look back over the last couple of decades, stigma about mental health has changed dramatically in society. It's still got a long way to go, but you can see that stigma shift reflected in literature. So mental health is usually the baddie, right? It's a slightly scary person who's done something bad, especially in the kind of thrillers or the crime writing series. It's part of your consultant service. Obviously, you want to make sure you handle mental health sensitively and interestingly, but how have you seen sort of mental health change in literature, and how is that helping address the stigma issues of different mental health conditions?
I really feel like we've made some good anti-stigma strides in even just maybe the last handful of years. And partly what I think has maybe really helped was actually, this sounds a bit bizarre, but was COVID. COVID was like awful, right? But what I think it showed was so many people noticed their mental health being affected in one way or another by the fact that we were going through this very frightening global pandemic, and also that we were in lockdowns for so many months at a time. And it was like the whole of society went, oh, I have a mental thing and it can feel healthy or it can feel less healthy, or I can experience like anxiety, or I can feel like really low and I can struggle in my mood. And it was like suddenly the world was like, mental health is a thing that we all have, and we can all feel not very well in it at times, and we can become ill in our mental health. So I think it felt like that went a really long way of collapsing this distinction, which has been around for so long between them and us. You know, you could talk about your physical health, and everybody had physical health, and physical health was just a normal part of everyday life. But mental health, that was a completely taboo thing and shameful thing. Whereas now it feels like parity between physical health and mental health, that there's simply two different aspects of health, both of which are equally important and relevant. The stigma is really shifting, and I'm so pleased to see it. And I think it's sort of iterative, isn't it? It's going to be reflected in literature. Literature is going to be portraying mental health much better as society as a whole understands it better, but also literature and storytelling in general, whether that's TV, film, books, podcasts, it can help in destigmatizing things by portraying it correctly. This is the reason that I wanted to set up the consultancy. People can decide they want to write about something to do with mental health because they feel like it'll be a good storyline, but they simply, through lack of understanding and information, portray things in a way that simply perpetuates stereotypes and therefore stigma, because they've only come across stigmatizing stereotypes. So they just recreate that in their work. And I wanted to just provide a resource.
It's such a useful service, not just for author in general. I love the point that you made about COVID, because it was an interesting time where like lots of stuff sped up, but a huge amount of stuff slowed down, right? Mm-hmm. We were all forced to observe how we felt for the first time for a long time. I think that allowed us to take that step away from our emotions and actually become an observer of how we were in a way that we hadn't done before. You've got your kind of Dr. Philippa East, and you've got Philippa East, the creative writer, and now you have Dr. Philippa East, the kind of creative consultant that works with authors. What do you do to look after you and all of the characters that you look after in your head?
Probably a good place to start is I have done a lot of my own therapy throughout my life. I've had my own difficulties. Again, this is partly a reflection of the destigmatization, that I don't find it problematic or difficult these days to say I'm a clinical psychologist and I've also suffered with depressive episodes, severe anxiety, an eating disorder, and had treatment for all of these. Which again, I think is a real step forwards, because again, it was like, well, yes, we know that there are people that struggle with their mental health, but the mental health professionals are obviously saying that, of course, they would have to be. Now, I think there's a much better understanding that, you know, a lot of people go into this field because they can relate. I've done a lot of therapy over my life, and that means that I've hopefully done the work to sort out as best as I can the things that trip me up, the things that affect my mental health. I suppose the message in that is, if you need help with a problem, go and get it. Don't feel that you shouldn't, you can't, or especially if you're a practitioner yourself, that somehow you shouldn't be needing any help for your own issues or difficulties. And then a lot of stuff is those really basic principles, isn't it, about being able to say no to things so that you learn not to take on too much and burn yourself out. One of the things I think about is often, especially as successful, ambitious, conscientious professionals, we can be really good at ticking the boxes of things like productivity and achievement. But I think that we need to get really good at being lazy. I do consider myself a productive person. I wouldn't have got where I am today if I weren't. So I'm very able to work very hard and be very conscientious about things. But I've also had to work at learning to sit around on my bum and just read a book or have a nap or have a lie-in and be okay with that and recognize that is a really important part of just being healthy and being well, and it's valid. Going down the route of becoming a published author, the publishing industry is actually really brutal. So I've had to think quite a lot about how we build our resilience if we hang all of our self-esteem on one peg, and that peg is the domain in our life that isn't going very well. We're naturally going to feel really rubbish about ourselves. So a way to ensure much more robust self-esteem is to have multiple pegs that we can look to and hang our sense of self and our self-esteem on.
Thank you for sharing those. Lots of kind of valuable information, and I'm sure your story resonates. I don't think I know anyone in this space who hasn't had some personal experience, right? We're all in it because we care about it, not just because it was a good income stream suggestion at the career service at the end of school. You're a psychologist and you look after yourself. How do you handle the blank page? How do you handle writer's block? What's your advice to people who want to write their first word?
I've got two answers to that question. First of all, there's the term writer's block, right? Which basically means someone is not able to write, i.e. they're not able to get in front of the page or the computer and get the words down, or they just aren't translating whatever's on the inside. And I think the first thing that I would say, like we would with any kind of client that comes to us with a problem or a condition, we would formulate it, right? So writer's block, the term writer's block, I think can and does refer to all kinds of different processes and issues that are going on. So it can be connected to some form of perfectionism. So the idea that I don't feel that what comes out is good enough, so I don't put anything down at all. Or it can be fear of being judged. If I actually put this out in the world, I'm going to have to face critique and I'm too scared to do that. It can be that people are feeling, for other reasons, mentally and emotionally overwhelmed, so they can't get the headspace to generate ideas or to think how to translate those ideas into specific words on the page. So if someone has writer's block, I would probably want to try and figure out with them what is the block and what is stopping them. And then, like in any good kind of therapy, then we can help people actually then problem solve how to move past it. My advice for anyone who wants to start writing and is struggling to do that would be a couple of things. I like the mantra, don't get it right, get it written. A lot of the time people pick a published book off the shelf, they read it and think, oh my God, it's amazing. I wish I could write like that. And then they sit down at their laptop and they write down 3 sentences and it doesn't come out like that. And they go, oh, I can't do this. And they give up. And what you need to know is the first 3 sentences of a manuscript that a published author writes are also terrible. We go back and we spend like 9 months editing and editing and editing. So the starting point is just start and write it badly.
Oh, lots of great advice there. Let's end with the big ones. Imagine you're Dr. Philippa, you have all the experiences you've got, and suddenly overnight you wake up and you're head of the NHS or the Prime Minister or like the global president of everything, and you get to change one thing about the mental health system that you think would be fantastic to help lots of people. What would you do?
This is just such a difficult question. Maybe going back to the thing that everybody has mental health, we probably, even when we're doing pretty well in our lives, could benefit from therapy, right? Because therapy can almost blur into things like life coaching. So we can go from being good to being amazing. So part of me would want to say we would have way better overall funding for mental health care, because that's always been a bit of a Cinderella service and it's always fallen behind and people have always had a pretty shoddy service. But it can also be quite difficult because where do you draw the line? What is kind of illness treatment and then what is just, it's great to have therapy to sort out what you want your next career move to be. I'll break it down into something much smaller, which goes back to something that became a real issue for me and one of the reasons why I left my NHS job. And it was that in an underfunded NHS service where resources are understandably limited and managers in the NHS are having to make the decision between giving a small number of people a lot and giving a lot of people a limited amount. So that often means that we are offering patients less than we ideally would like to on the basis that something is better than nothing. And I understand that. But the thing I would want to change is how that is presented to patients, because so often it's presented to patients that this limited amount that we're giving you, which is less, for example, than the evidence base and the guidelines, is all you should need. So the number of times that I hear people saying that they were referred for therapy on the NHS for, say, anxiety or depression, and they got 6 sessions. And then they did that and they didn't really feel a lot better. And they think, well, I'm probably just never going to get better then because I had the treatment and it didn't help. And I will say 6 sessions is not enough to actually treat properly even mild to moderate anxiety or depression, and you're being sold it as if it should be enough, and then you feel like you're the one who is somehow broken or failing or a hopeless case because you didn't get better. So I think we need to be very clear with patients that if we're offering 6 sessions, it's the something rather than nothing, rather than the answer. So that's maybe a slightly pessimistic answer, but yeah, that's something that I would change.
It's a great answer. Managing expectations would be a huge benefit. So I think it's a great idea. Ultimately, I think if we could invent something, it would be a personalized sort of psychological self-coach for every person on the planet that could do proactive work with you so that you didn't have to get to the point where you were going to be referred into therapy. And eventually that will be possible. Like, technology will enable that in some way. There's a lot of science for us to discover first because psychology is new. It's been an amazing pleasure. Thank you, Dr. Philippa East. I'm sure everyone will really enjoy this podcast.
Thank you so much, Charlie.
Thanks for listening to Self Matters. We've got new episodes out every 2 weeks, so make sure you hit follow and subscribe so you never miss an episode. You can listen to us on Spotify and Apple Podcasts, and of course watch us on YouTube. As always, head over to our social media channels to find out who'll be joining us in the next episode. That's all for today, though. See you next time.